Next thing you do is palpation. So when you palpate the shoulder, you start at the scapula in the back, the shoulder blade. You palpate the scapular spine. You can follow that right out here to the acromion, which is here. And here is the acromioclavicular, or AC joint. And right down from there, here is the bicipital groove where the biceps tendon goes. You check all these for any deformity or any tenderness. Next thing we'll do is range of motion, and I'll just get Bill to do what I do. So we'll check for the shoulder flexion, where the arm goes straight forward and should go all the way up to 180 degrees. Extension, same thing going back, with the arc going back, good. And abduction, where the arm goes straight up in an arc all the way up over your head to the top, just like that. With the shoulder, you can also test rotation. For internal rotation, you check with one thumb going to the opposite shoulder blade, and do the same thing with the other side now. One thumb to the opposite shoulder blade, good. And for external rotation, just put your hands up behind your head like this, with the elbows out, and that's full external rotation.
Handout for the musculoskeletal system, but I'm going to use the knee as an example just for some basic techniques. First of all, beginning with inspection, and as I'm sitting in front of the patient looking at, in this case, his knees, I'm looking for whether there's any obvious asymmetry, bruising, redness, swelling in any particular area, and I've already watched the patient as he's climbed up onto the exam table to see if there's any evidence of a disability or impact that the pain or the joint problem is having on him during his movements. And so most of that inspection happens just with your eyes. All right. What I may, again, I'm starting to just inspect the elbows to see how he's holding his arm, whether he's splinting it, whether there's anything obvious that I can see just by watching him. What I'll start with is just have you move your arm, put your arms out in front of you with your elbows together. Okay. And I'm just seeing that he can extend his elbows completely and looking for symmetry in the carrying angle, the way that his forearm is related to the upper arm.
You can palpate the elbow next. You palpate the epicondyles. This is right here. That's tender in people that have epicondylitis, tennis elbow. The olecranon process back here. And you can look here next to the olecranon for any effusion, any signs of swelling.